Yes, I'm Jenni Murray. I'm Programme Manager for Yorkshire and Humber PSRC. And I'm really delighted to be here because I feel I've got quite an important message to pass across to everybody, as we all have. And I just wanted to thank the organisers for putting me in after Ramani. That's really not a hard act to follow. What I probably will do is be looking at my notes, so apologies for that if I'm not quite the polished article, but I'll be doing my best. So, maturity models. I don't know if anybody's familiar with maturity models. I'm not going to ask people to put up their hands. But maturity models really are about measuring, capturing, reviewing different institutional processes through time in an organisation. And maturity models really stem from industry. And more recently, they've come across into EDI. So we're starting to see EDI maturity models being developed. And this definition that I've got up here is quite important, and I want you to sort of reflect on this a little bit because I'll come back to this. And maturity is defined as a degree to which a process is institutionalized and effective and whereby the process is no longer needed. So in terms of the culture of our research organizations and how we enact our research processes, we need to think very carefully about the existence of things like EDI strategies and what we do with those and how we assess those, how we assess the success of the implementation of those. Because we can develop EDI strategies, but how do we know they're actually doing something? How do we know within our teams where the problem areas are? So this is where maturity models come in. So why develop an EDI maturity model? Partly because we were kind of told to do this. So when the PSRCs started in 2023, the NIHR were very sort of forthright about thinking strategically about inclusion. And to that end, they asked us all to develop our EDI strategies, which we all did. And they also asked us to consider our EDI maturity. And this particular model was presented to us. So this is called the VESA model. Some of you might have seen this. And basically, the model consists of 5 levels of maturity according to equity, diversity, and inclusion. And if you were to assess your own maturity in terms of your PSRC or linked organizations, you might come out anywhere from compliant right up through to the top level, which is innovative. So the question you might have is, well, this is lovely, but how do I actually assess this in my team? And so this circle thing is your front of house, and the inner workings are what happen in the background, and this is what makes these maturity models really good. So with the VESA model, they had 10 questions, and each question is rated on a 5-point Likert scale from strongly agree to strongly disagree. And those ratings are converted into numerical scores. So this questionnaire, it goes out to all the team. And they'll take probably 2 or 3 minutes to complete, and you convert your scores, and then you end up with your levels. So the lowest one being compliance, the highest one in this case being innovation. So there's nothing wrong with the VESA model. Actually, the VESA model is pretty good. But when we looked at it in terms of a research organization, it didn't actually address research processes. And also, it was looking at representation as opposed to things like power dynamics. And we were really keen on having something that reflected our EDI strategy, was meaningful, could help us develop our team further, could help us to perhaps naively reach maturity. So we looked out and we identified 6 EDI maturity models. 4 of those were relevant to what we wanted to do. So in developing our own EDI maturity model, we reviewed those models, we reviewed the questions in those, the items, and we did a lot of backwards, forwards, toing and froing, sharing understanding about what we thought each of those items represented and where they fitted within our own research processes and our own research culture. We consulted with a number of stakeholders, so we spoke to EDI leads across SafetyNet, we spoke to public representatives, and we spoke to senior leaders in our own PSRC. We established a scoring system, so in the way that the VESA model has a scoring system, we wanted something that was straightforward and was familiar to existing EDI maturity models. And we then created descriptions for each of the levels, and we provided names for those. So everything that we did was sort of meaningful and well thought through to ensure that this model that we were developing was something that people would see as acceptable and relevant to their teams. We then designed the final model, which is the front of house bit, and then we piloted that in one site. So this is the sort of an example of the background inner workings of our model. This is the background bit, not the fancy model, but with the blobs. So the EDI maturity model contains 7 domains, so it covers things like the working environment, leadership, learning and sharing, capacity building. So you hopefully can see that what we're trying to get at is both the culture in our team as well as our research processes, because if we really want to tackle safety inequities, we've really got to look inwards on ourselves and really understand what's happening in our own teams in terms of culture. What are the skill sets of our teams? And the best way to do that is obviously to ask the team themselves. So our particular model has 15 assessment questions. FASA had 10. And so we have some examples that I have the necessary skills and knowledge of EDI to confidently embed it across the research cycle. So these sorts of things, both addressing our skills in terms of the research process and our culture. And each of those questions, similar to the VESA model, also is rated on a Likert scale, and so we have a numerical scoring of 5 down to 1. This is our front of house. This is our pretty model. This is what you would see if somebody did an assessment of their own EDI culture in their own team. They could publicly show this if they wanted to and show the level that they were at. I mean, it is lovely, and it's very pretty, and it's very similar to the VESA model. It's the background that's different. So we have a top score of 75, so that's what we call leading, which would probably be sort of equivalent to innovative. And then we have a lower score of 15, that's the lowest score, so it's 1 score per item, and that's the starting out. We debated over the names of these levels quite a lot, and we wanted to be positive and encouraging. And in each of the descriptions for each of the levels, what we're trying to get to is, if you are at a particular level, what's the likelihood that you would have an impact on safety inequities? So we did a pilot in our own site, and this is what we found. So basically, we've got 42 responses across our own PSRC, so that's 65%. And all of the questions were answered, which is positive. It took 3 minutes to complete. I don't know if that's a good thing or a bad thing. It could be good, as in it was clear and people sort of got it, or it could be that people aren't really thinking about the answers. I don't know. There are things we don't know yet just by running this pilot, and we came out at advancing, which is, success to us, pats on the back, all the rest of it. So, but the key thing that we took away from this is what the actual individual scorings on the items were telling us. So we bracketed things into areas for improvement and areas where we saw strengths. So we saw opportunities for improvement around skills and knowledge. So this is really about embedding EDI in our research processes. And then we looked at how could we raise the voices of marginalised groups, both within our team and externally. Areas where we were strong were around leadership, and individuals also felt like they could be themselves in the workplace. So it's really, for us, it's not so much the level that we've arrived at, but it's the content within that will help us reflect back on our EDI strategy and think carefully about where there's opportunities for improvement. So some reflections. I want to point out that this is not a scale. So I'm conscious there are a lot of researchers present in the room. This is not a scale. This is not a research tool as such. This is a temperature check, albeit quite a meaningful temperature check. And whilst we have some gauge of it has face validity, there's probably more we need to do so that people have confidence in using it. So that's one of our next steps. We actually found the tool really useful in terms of helping us to think, amongst other forms of intelligence, where it is that we could do improvements. So we see this as one of a suite of intelligence sources that help us understand what our team are thinking and feeling and where our strengths lie. Obviously, going out and gathering the team's perceptions of stuff is definitely valuable for us. Because when else would you really do this? When else would you be able to gather this data so quickly and gather real insights that would help you plan for the next steps? And just to say that when we sent out the survey, we sent it out to the team, we asked people to be really honest, to not put down what they think they should put down, because this can be something that's something that would happen around this sort of stuff. And what we didn't do was we didn't collect demographics. So part of that is because we'd just been out about a few weeks before, I think it was, and we'd collected some demographic data just to understand the makeup of our team. The other thing is it's quite a small number and we didn't want anything to be identifiable, but we feel it's really important going forward that we do gather demographic data that helps us look at this EDI maturity model survey in a more nuanced way. So there's some sort of next step things. And it's not moving. Oh, there we are. Just some takeaway thoughts. And this is where I want to go back to that original slide about how to define maturity. So in the context of EDI, and actually in any context, we're social beings. We don't live in a vacuum. So things that are going on around us in society, events, discourses, will likely influence the way we think and feel about things. The other thing to say is that we are primarily a transient workforce. I've worked on contracts pretty much all of my professional career, and I've moved around, and there are a lot of researchers who do that. So it's like, penguins in the Antarctic, the change of shape of a research department happening all the time, people are coming and going. So I suppose my question to everybody is, what implications does this have, these two things have, on the idea of being able to reach maturity in terms of EDI? And I have the answer for you. The answer is, it's good and bad. The answer is, if you think about the EDI maturity model in terms of this pretty diagram, well, yes, we could be at leading at the minute, or we could be at advancing. If we drop down in, say, 2 years' time to emerging, that's okay, because we are a transient workforce, because we'll have to have new skills development, because the discourse may change. So what I'm saying to you is, for people who decide to adopt this model and have a look at their team, don't be afraid if you come out at starting out. It probably doesn't really matter. What it is a tool for improvement, and that's the benefit of the model. So, final remarks, you'll be glad to know. We see this as a listening tool, one of many, and we see it as a valuable way of evaluating the implementation of our EDI strategy, allowing us to be accountable, allowing us to listen to our staff and to make changes as consequence. And some of those changes aren't necessarily going to be easy, but we're having a go. And the final thing to say is maturity is much more than a level. So if we look at it as just as a level, we're really missing a trick. And the final messages are that what we'd really like to do, NIHR are quite keen on this. We didn't expect this to be something that people would really pick up on, but they have. So NIHR are very keen for us to roll this out across infrastructure. If we can roll this out across SafetyNet and gather demographic data at the same time, we'll have a really good data set for understanding how all the PSRCs think about EDI and about the potential opportunities, therefore, as a larger team to impact on safety and equities. And that's it. Thank you.